Let's talk about this dirty little secret that the statin drug industry wants to keep from you. And statin drugs, of course, are the cholesterol-reducing drugs that are very commonly prescribed. And you know what? I practiced cardiology for 25 years, and I also prescribed them, at least in my early days of my practice, to many, many thousands of people. I even took them myself, and they, by the way, made me personally very ill. And patients I saw also get very ill on these drugs. Now, the drug industry and the apologists for the drug industry often say, oh, no, no, no. Side effects like muscle damage occur in less than 1%. That's true. What they're referring to is a process called rhabdomyolysis, where a blood protein, a muscle protein called creatine kinase, or CK we say, goes way up high, reflecting grotesque amounts of muscle damage. So bad it can actually damage your kidneys. That is a bad problem, and they're right. It only occurs in about 1% or less of people. What they're not telling you is there's far more common muscle weakness and pain that doesn't really cause extensive muscle damage, and maybe only a minor rise in creatine kinase. This is extremely common. In my experience, it affected almost everybody, especially at higher doses and the longer you took these statin drugs. And people would say things like this: I can't get in and out of my car, it's real hard. I feel like I've aged 10, 20 years overnight. I can't handle the same kind of exercise I used to. So it really has an impairing effect on muscle function. But the one little secret they don't want you to know about, and they didn't even look at in most studies until recently, is the increase in type 2 diabetes. Now, estimates vary and the data is not the cleanest, but there's probably somewhere in the order of 10 to 50% increase in new diabetics and people who take statin drugs. But the little secret in here is that, and so they poo-poo this. A lot of the apologists for the statin drug industry say things like, well, you know what? Okay, so there's a 30% increase or so in type 2 diabetes, but on the whole, you benefit. I'm not so sure about that. If there's a 30% increase in type 2 diabetes, how do you justify taking a statin drug? Well, they say things like this. Well, statin drugs reduce heart attack by 36%, 44%, 55%. Well, that's not true. That's a trick of statistics they're using. They're using something called relative risk. Relative risk would be something like this. If I have 100 people in a study who take a drug and there's one heart attack, another group of 100 people who don't take a drug, take a placebo maybe, and there's 2 heart attacks. So 2 heart attacks placebo, 1 heart attack drug, that is reported to you as a 50% reduction. But of course it is not. And of course when you tell doctors, and then thereby their patients, that there was a 50% reduction in heart attack on this drug, what people hear is of 100 people destined to have a heart attack, 50 will not have it, right? That's what you really hear. But if you go back to the original data, you see that the reduction in heart attack is very, very modest. So can that kind of modest reduction, like a 1%, 2% in heart attack and other heart events, justify a 30% relative increase in diabetes? You can see the problem here, right? But the problem I'm getting at is not so much the type 2 diabetes. That's bad enough. The problem hidden away behind all this is that there is a broad worsening of insulin resistance. Remember that insulin resistance is the process that leads to type 2 diabetes. So many people who are type 2 diabetics started by experiencing increasing severity of insulin resistance, meaning your body, your muscle, your liver, your brain don't respond well to insulin. So the pancreas compensates by jacking up its production of insulin. So if you check a blood insulin level, fasting, in these people, you'll see levels of 30, 40, 50, where a healthy, slender, active person should have a level of 1 or 2 or 3. So people with insulin resistance have levels that are 10-fold higher, 20-fold, 30-fold higher, much, much higher. And by the way, that high insulin level also makes you gain weight, because insulin is very effective at causing fat deposition and blocking fat mobilization. So that's a very serious thing to have. And it also tends to increase fat in the visceral fat stores, that is the inflammatory fat in your abdomen, around in the intestinal tract, fat around the liver, around the kidneys, around the pancreas, and also, by the way, around the heart. So the high insulin levels is a very bad thing. So statin drugs increase insulin resistance. Now it varies from drug to drug. The worst one is probably atorvastatin, Lipitor, which is probably one of the most popular statin drugs prescribed. Worsens insulin resistance. But what kind of consequences does that have? If you take a drug, and by the way, and also give you a diet that doesn't help you, right? If you follow a diet low in fat, low in saturated fat, rich in healthy whole grains, what does that do? It worsens insulin resistance because you're being exposed to carbohydrates, especially the amylopectin A, super carbohydrate of wheat and grains that gram for gram is worse than table sugar. And that, of course, causes high blood sugar, high blood insulin, leading to insulin resistance. And so now we give you the wrong diet to start, right, in conventional practice, and then we give you a drug that worsens insulin resistance. And even worse, then we don't tell you about all the nutrients absent from modern life that also make insulin resistance worse, like vitamin D, magnesium, omega-3 fatty acids, and iodine. So take statin drugs, worsen insulin resistance. What does that do? Well, of course, yes, it increases your likelihood of having type 2 diabetes, but it also increases the likelihood of so many other health problems. It increases potential for heart disease. So these drugs are supposed to reduce incidence for heart disease, but it worsens this one aspect of heart disease causation. It also, if a woman has a tendency towards polycystic ovary syndrome, taking statin drugs will worsen that potential because a lot of the phenomena of polycystic ovary syndrome, like infertility and diabetes, of course, and hypertension and excessive hair growth on the face and elsewhere, is driven by insulin resistance. The insulin resistance of statin drugs can worsen arthritis because it causes higher blood sugars and thereby glycation, the phenomenon of glycation, glucose modification of proteins, which is a phenomenon of aging that brings out brittleness in cartilage and causes arthritis. A worsening of insulin resistance increases your potential for Alzheimer's dementia. You've probably heard that Alzheimer's is also called type 3 diabetes, that is insulin resistance in the brain. So statin drugs worsen insulin resistance, including in the brain. And then lastly, a worsening of insulin resistance increases your potential for cancer. Remember, cancer loves sugar. That's why you image cancers with PET scans using radio-labeled glucose, sugar. That's how you light up a tumor. And when you have insulin resistance, your blood sugars, your blood glucose goes up, and you encourage tumor formation. So insulin resistance is a fundamental process underlying literally hundreds of health conditions. And these drugs, statin drugs, are prescribed like crazy. Doctors bully their patients into taking them, all for the sake of a relatively trivial reduction in cardiovascular events. As I often say, the biggest tragedy of the statin drug market is not that these are kind of stupid drugs that have very little effect, is that it takes everybody's attention away from the things that really cause heart disease. Now, see my other videos for that conversation, and also join my conversation in my Wheat Belly blog, my Undoctored blog, and of course my Wheat Belly books and Undoctored books, and the most recent updated version of my program in the Wheat Belly Revised and Expanded Edition that has the entire program I follow. That is the program I developed for stopping or reversing coronary disease. So very important that you get these things right, because it won't come from your doctor, it's not going to come from a low-fat diet, and it certainly won't come from a statin drug.